Sulfonamides. Sulfonamides are considered as bacteriostatic. So indications, so these antibiotics are broad spectrum, meaning they cover gram-positive and gram-negative organisms. Now they're usually used for UTI, otitis media or OM, upper respiratory infections, and some STDs. They are also used for pneumocystis carinii, or some people would pronounce this as pneumocystis carinii, as well as pneumocystis jirovecii or jirovecii. So basically they are the same diagnosis, it's just that they used to call it pneumocystis carinii, and then now it's called pneumocystis jirovecii or jirovecii. So this is a type of pneumonia. This is basically a fungal infection that affects people with weakened immune systems, such as those with HIV or AIDS. Some side effects of these drugs include allergic reactions. So basically the most common one would include fever and rash, pancytopenia. So pancytopenia meaning decrease in WBCs, decrease in RBCs, and decrease in platelet, and also blood dyscrasias, liver and renal dysfunction. In addition, sometimes it can cause some photosensitivity, Stevens-Johnson syndrome. So Stevens-Johnson syndrome consists of fever, flu-like symptoms, and it also includes skin rash, blisters, and afterwards the skin starts peeling off. Some precautions include liver and renal disease. It is also important to consider that this drug has many drug interactions. Contraindications include sensitivity to sulfa-based drugs, thiazide and loop diuretics, sulfonylurea, especially glipizide, and so on. It has 10% chance of cross-reactivity. So if these people are allergic to the previously mentioned drugs, then they are likely allergic to this group of medications. Nursing actions follow: monitor, analyze your CBC, LFTs, BUN, and creatinine. So CBC, your complete blood count; LFTs, your liver function test; BUN and creatinine would consist of your renal function test. Examples of drugs in this class, the one that we have to know is the commonly prescribed Bactrim. So Bactrim is sulfamethoxazole trimethoprim. Aminoglycosides. Aminoglycosides are often used for more serious or life-threatening infection, so they cover mostly gram-negative and some gram-positive. So it's often used in combination with other antimicrobial agents. Side effects: that's why we have to be very careful, and that's why we usually use it in life-threatening infection, is because this drug is nephrotoxic. So it can increase your BUN and creatinine, and it can affect your urine output. Now this is also known as an ototoxic drug, so meaning it can cause some ear problems, it can cause some dizziness, tinnitus, hearing loss, so it can damage the inner ear. Some precautions include liver and renal dysfunction. Contraindications include pregnant and lactating women unless there's a life-threatening infection. So now we're going to have to consider risk versus benefits. Nursing actions include analyzing and monitoring your complete blood count, your liver function test, and your BUN and creatinine, which is your renal function test. Now we have to ensure to check for the peak and trough drug levels. So it needs to be done appropriately. Now, if you could recall, peak means the highest concentration of drug in the patient's bloodstream. Trough, on the other hand, is the lowest concentration of drug in the patient's bloodstream, and this is usually before the next dose is due. You don't want this to be toxic or subtherapeutic or not effective for whatever you're treating for, and that's why it is very important to monitor your peak and trough. Examples of drugs in this class include amikacin, gentamicin, and tobromycin. You also have to remember that aminoglycosides are bactericidal.